guys, thank you for visiting my channel. Welcome or welcome back. For those of you that don't know me, my name is Kendra, aka Miss K. I've been a medical assistant since 2004 and a medical assistant instructor since 2011. Now, for those of you that have been visiting my channel, you're probably used to me having a background in the back, right? But I recently moved, and so I haven't set everything up yet, so bear with me until I get everything set up. But I know you guys haven't seen me on camera in a while. That's because I've had so much going on with preparing to move and then actually moving, and now I'm still getting unsettled. But I wanted to give 3 quick tips really quickly because somebody asked about tips for giving quality patient care. So I want to do that really quickly here. Smiling and being warm with your patient. So as you go, get your patient out of the lobby and you introduce yourself. Hi, I'm Kendra. I'm your medical assistant today, or I'm the medical assistant that's working with Dr. Jackson today. I'll be getting you ready for the doctor, or I will be taking your vital signs today. Nice to have you here. So you always want to be smiling and warm. I always say, think about when you go to the doctor. Have you ever had a medical assistant or nurse or front desk staff, just be short with you and make you feel like you don't matter, or just make you feel like maybe you're even annoying to them, like they don't really want to care for you? Do the opposite of that. You want them to feel like you're happy to have them there. You want them to feel cared for. Think about if it was you, your loved one. And so you want them to feel special. You want them to feel taken care of. For me, I enjoy even just making my patients smile. Sometimes I get patients to say, "Thank you for being so nice." I'm like, "You're welcome." And that makes me feel good just because I made them feel good. So think about that. I know sometimes you can be going through something at home, and I get it. And sometimes it's hard to be happy when you're not happy, but you definitely have to learn how to leave your issues at the door, because your patients, your managers, your co-workers, they're not going to care about what's happening at home, even though, yeah, we all have problems. But one of the first rules in healthcare is to leave all of that at the door. Another thing you want to do is greet the patient by their last name. So I know that policies can be different at different offices. If you work somewhere and you guys call patients by their first name, definitely follow policy. But usually the rule is to address the patient by their last name. So Mr. Johnson, Mrs. Smith, every time you talk to Mr. Johnson, do you mind stepping on the scale? Mr. Johnson, is it okay if I check your blood pressure? Mr. Johnson, is it okay if I draw your blood? Once you have done patient identification, you have their first and last name, date of birth, you want to just address them by their last name. It's just a sign of respect. And also by you using their name when you're addressing them, it makes them feel seen and that you haven't forgotten their name. Because the worst thing you can do is in the middle of talking to someone and then you forget their name or you call them the wrong name. And lastly, I want to say, if your provider is running behind, you want to check in with the patient and you want to let them know that there is a wait. So Mrs. Johnson, I'm so sorry. I just want to let you know the doctor's running behind. Is that okay? Are you okay with waiting? They say yes. Would you like a drink of water? If you're able to offer that to your patients. I know every office is different, but offer them something, offer them a magazine, but always let the patient know. Don't just leave them in a room. If the doctor's running late to the office and they haven't arrived yet, let the patient know that. Always give them the choice of waiting, because some patients may choose to reschedule. Okay. Sometimes I've had patients that didn't want to wait in a room and they wanted to wait in the lobby. So you always want to keep them, in the loop. Let them know what's going on, give them options, whether they want to reschedule or wait around. Offer them something, like I said, a drink or maybe a magazine if you have them in the waiting area, but don't ever just leave the patient in a room. And the worst thing is when your patient is in a room and they're coming out trying to figure out what's going on. Hey, did you guys forget about me? Now, you will have some patients that are just, anxious, that's just going to ask regardless. Maybe they were only in the room for 3 minutes and they already coming out. There are some patients like that, I get it. But I mean patients that are actually waiting because the doctor is either running behind, the doctor hasn't even made it to the office yet, or because the doctor is still with another patient. And especially if we've had an emergency in the office, that happens too, where the patient really has to wait a while. Regardless, whatever it is, let them know and give them the option to wait. So hopefully these are helpful. Do me a favor, guys, and add some more in the comments. There's so many ways to deliver quality patient care. I am big on quality patient care. My goal when I have patients in my presence, I want them to feel good. I want them to feel taken care of. I want them smiling. Of course, some patients are not always going to smile because they may be sick. They may be going through different things or whatever. But I just want them to know that I care. One thing my patients are going to know that I care And I actually find joy. It makes me feel so happy to know that I've been making a difference in my patient's life in that short time that they were there, whether it was just smiling at them, taking care of them, getting them some water or whatever. And guys, don't forget, I do have my MA refresher course. So for those of you that are preparing for certification, I'll leave the link down below. This is also for people who are, you know, already in the field. Maybe you never got certified and you need to get certified. That's for you as well. And then also, if you've just been out the field for a while and you just need a refresher, it's for you as well. It's at marefreshercourse.com. Also, if you've been working in the field but you never went to school, I do run into people like that have been in the field for a long time. They got trained on the job and never got certified, and now they need it. It's for you as well. Thank you again for visiting my channel. Be blessed.